Hi, I'm Dr. Jerry Brewer, one of the dermatologic surgeons at Mayo Clinic in Rochester, Minnesota. Today I'm going to be talking to you about an important skin cancer called melanoma. I'm going to tell you what melanoma is, the risk factors for melanoma, and how melanoma is diagnosed and treated. Melanoma is a type of skin cancer that starts from a dark spot or a mole. Melanoma usually starts in a dark spot that has multiple colors and sometimes has a jaggedy edge. Melanoma can happen anywhere on the body and does not necessarily have to occur in an area that has received significant amount of sun in the past. Although melanoma is not the most common form of skin cancer, it can be one of the deadliest. In fact, one person dies every hour of melanoma in the United States. The risk factors for melanoma include red to blonde hair and blue to green eyes, tanning bed use, having a lot of moles on the body, and having some moles that look funny or are otherwise called dysplastic nevi, having a family member with melanoma, and also having received a significant amount of sun to the point of receiving severe blistering sunburns in the past. If a person has one or many of these risk factors, they could be considered at high risk for developing melanoma. The chances of surviving melanoma is directly correlated with how early it is caught. Thus, a person who is at high risk for melanoma should be encouraged to participate in certain behavioral recommendations that can increase the chances of catching melanoma early. These behavior recommendations include looking at your skin from head to toe at home on a monthly basis, taking pictures of areas that have a high concentration of moles to compare for changes during future skin examinations at home, avoiding tanning beds and excessive amounts of sun, and finally seeing a dermatologist once a year. When performing self-skin examinations at home, there is a rule of thumb that can be used to help you decide if a mole is potentially worrisome or needs to be evaluated. This rule of thumb is called the ABCDEs of melanoma. A stands for asymmetry, meaning that the mole has one half that looks different than the other half. B stands for border, meaning that the edge of the mole is no longer smooth or has a jaggedy appearance. C stands for color, meaning that the mole has multiple colors within it. And D stands for diameter, meaning that the mole has grown and can no longer be covered by the eraser of a pencil. E stands for evolution, which means any other subtle change that may be happening in the mole, such as the mole becoming itchy or bleeding. If a mole has some worrisome features to it, then a biopsy would be performed, where the mole is removed and evaluated under the microscope. The treatment for melanoma depends on how thick it is at the time that the melanoma is biopsied. Although melanoma is a scary cancer, many people can be cured from melanoma by a surgical procedure where a margin of normal skin is removed around the melanoma, called a wide local excision. In addition, many people will be required to have a sentinel lymph node biopsy, which is a procedure where the closest lymph node to the melanoma is removed at the time of surgery to see if the melanoma has spread to that area. In addition, there are a few patients that will be required to undergo other therapy, such as immunotherapy or other forms of chemotherapy. Melanoma can be scary. However, if diagnosed early and treated properly, many patients can survive the diagnosis of melanoma. If you have been diagnosed with melanoma, or are at high risk for melanoma, seeking out a group of doctors who have been trained to treat melanoma is your best option. Here at Mayo Clinic, there are a large number of doctors that have been trained specifically to treat melanoma. These include dermatologists like myself, general surgeons, medical oncologists, surgical oncologists, radiation oncologists, radiologists, and full-time researchers. We are ready to treat you with the best possible treatments available, and to perhaps take away some of the scariness associated with being diagnosed with a melanoma.